Welcome to the Holistic Health Bites podcast. I'm your host, Andrea Nicholson, here with bite-sized episodes to empower, educate, and enlighten you with ways to lose weight, heal your gut, and achieve your ideal health so you can live an adventure-filled life. Let's dive in. In today's content, we are discussing the little-known effects of blood sugar dysregulation and how to manage it. So what is blood sugar dysregulation? Blood sugar dysregulation is when your blood sugar levels are constantly fluctuating or staying chronically elevated. This can be caused by a variety of factors, including stress, certain medications, and of course, an unhealthy diet. So what are the effects of blood sugar dysregulation? Most of us think about diabetes when we think about blood sugar imbalances, but it goes far beyond that. Studies have found that 88% of adults have metabolic dysfunction, of which blood sugar imbalances and insulin resistance are a big part. So it's likely you have blood sugar imbalances and don't know it. So what conditions are related to blood sugar dysregulation? Fatigue, anxiety, depression, poor stress handling, chronic inflammation, sugar cravings, increased appetite, an inability to fast or skip meals because you get hangry, you have headaches, migraines, an imbalanced gut, things like yeast overgrowth, chronic infections, joint pain, muscle stiffness, poor memory, brain fog, gaining weight easily and difficulty losing weight, high blood pressure, cardiovascular disease, high cholesterol or high triglycerides, fatty liver, loss of muscle and bone, even sleep disturbances and hormone imbalances are related. So how do you know if you have blood sugar dysregulation? Well, if you have any of the conditions that I just ran through, you likely have blood sugar imbalances. If you want to know for sure, there are a few great ways to find out. First would be blood testing. You want to look at fasting glucose, fasting insulin, and a hemoglobin A1C. The first marker of these three to get imbalanced is generally the fasting insulin. This is because the body is actually having to produce more insulin to keep blood sugars in the safe zone. But it can take decades for the A1C and the fasting glucose numbers to rise. The second option to find out if you have blood sugar dysregulation, and my personal favorite, is to use a continuous glucose monitor. This is a little device that's worn for about 2 weeks that continuously tests your blood sugars all day long. Now, this is the best way to know exactly what your numbers are doing all day and all night. Blood sugar imbalances don't always give outward symptoms, so this is the best way to know how your body is responding and handling certain foods and activities. You can also see blood sugar spikes associated with stress or poor quality sleep, even if you didn't eat anything. How do you manage blood sugar dysregulation? Well, there are a few things you can do to manage if you do have blood sugar imbalances. First is, of course, eating quality nutrition that prioritizes protein and healthy fats with lots of good veggies and minimal starch and carbohydrate. Now, this does not have to be a full ketogenic diet, although it can. It doesn't even have to be an exceedingly low carbohydrate diet. But being mindful of overall carbohydrate intake and carbohydrate sources will dramatically help. The average US adult is eating 200 to 300 grams of carbohydrate per day, most of which are highly refined and starchy. Cutting that down to even 100 to 150 will go a long way towards balancing blood sugars, but that's not a low-carb diet. Second, of course, is to manage stress and prioritize sleep. Stress contributes to poor blood sugar management, and poor blood sugar management adds stress to the body. It's a vicious cycle. And lack of sleep is also a stressor on the body and contributes to blood sugar imbalances, leading to poor food choices and overindulging. Third is move your body daily. One of the easiest ways to lower your blood sugar is to go for a walk after eating. This does not have to be a power walk or even a long walk. Even 10 minutes makes a huge difference in postprandial blood sugars, or blood sugars after eating. This is because when you're moving your body, you're shuttling sugar from your blood into the muscles to make them move. This means that you're burning that sugar for energy instead of storing it as glycogen or fat. So there you have it, little known effects of blood sugar dysregulation, how to know, what to look for, and what you can do about it. Many studies have found that it is possible to reverse blood sugar imbalances, and it's even easier with help. Coaching increases accountability, confidence, and clarity on exactly what to do. This is what I do for my clients every single day. We utilize testing and technology to guide your unique situation, and then together we formulate a plan that will work for you long term. Thanks for being a faithful listener to the podcast. I'd love it if you left me a 5-star review on this podcast so that others can more easily find this valuable information. Did you know I also work one-on-one with clients? I approach solving health challenges like I approached solving crimes, by conducting a thorough investigation into your case. Whether you're looking to lose weight, boost your energy, fix your digestive system, or reduce inflammation, I can help. All you have to do to get started is book a free call. The link is in the show notes.